Patient here is the police officer that's complaining of some butt pain and limited range of motion in his lumbar area and his hip. So we're just going to go right into some massage techniques. So typically we wouldn't do this over clothing, but just for these purposes, he does have shorts on. Okay. So we're first going to start off with some stroking. I would do some stroking here as well on the skin, just because this is going to be the area that I'm going to be working with, and we just want the patient to be very comfortable with the touch that I'm going to be doing. So just doing this, just to get the patient acclimated. And then I'm just going to go right into some petrissage techniques. So he does have that muscle spasm in his piriformis. So the piriformis runs like this way. So I'm just going to start with palmar kneading. It's a little bit hard to do it over the clothing, so I'm just going to kind of do these circular motions, making sure to use my lumbricals, but still trying to target those deep connective tissues in there just to break up that muscle spasm in there. So I'm just going to be doing this for a couple of minutes, and then after that I can still continue on with petrissage, and we can do a picking up technique, which we just kind of pick up this area where the piriformis is, kind of bring it in, and kind of let it ringing through my fingers. So pick up, slowly, let it go through my fingers just like that. So I'm just going to be doing that for a couple minutes as well. Same purpose as what we did with the palmar kneading, is to kind of break up the tissue in there as well. And since this is a little bit more of an aggressive massage techniques, it might even help with the release of endogenous opioids. And with that theory, it's stimulating the A-delta fibers with that noxious stimuli, and essentially just releasing some endorphins in the area for like long-term pain relief. So that would be really beneficial for this patient. And then after that, I'm going to go into, so he also has some limited range of motion in his lumbar area, so I'm going to actually do some skin rolling in this area. So I'm going to use a little bit more lotion. So kind of in this lumbar region, a more local area, and we're just going to kind of slowly just pick up skin with our fingers and kind of roll this way. So I could do it on the other side too. For just these purposes, this is a better position for me. And then what this is doing is it's helping mobility of that subcutaneous tissue in the area, which there could be some limitations with just the adhesions in the area. So this is just kind of letting that skin be more mobile and will help with the range of motion. Okay, so after the petrissage and the skin rolling, what I can do is do some effleurage at the end, just to kind of move that interstitial fluid, make that more mobile. Since we did work a lot and break up the tissue, we do want to move some of that waste out, but also help move the fluids more centrally. So I'd also do it, and I can do it this area too, so I'll kind of show it here since it's a little bit easier. I just do some effleurage, nice and slow, 7 inches per second, and I do the same over here, maybe more towards like the lower extremity. And making sure to kind of pause for a second before lifting our fingers off. And then after effleurage, I just finish up with some stroking just to finish everything off. And as the adjunct activity, I have the patient do a piriformis stretch, just since because he did have a muscle spasm to begin with in that area. I'd have him do a stretch just to kind of make that tissue a little bit more extensible. And then if we did any pre-assessments such as range of motion, I do range of motion